Good afternoon. We are gathering on what would have been my mother's 105th birthday. And by the way, she ended her life for many years in assisted living and in a nursing home. And had she been alive today, those would be areas that would all be quite concerned about, as I know you are, Judy. So more on that in a little bit. So God bless Mom. Joining me up here today, again, the woman on my right who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. To her right, State Epidemiologist, Dr. Christina Tan. Thank you, Dr. Tan. And to my left, State Police Superintendent Colonel Pat Callahan. Also with us is the Homeland Security Director, Jared Maples, and other members of our team who will be able to answer some of your questions. Over the past 24 hours, so this is since the paper release that we put out yesterday, we have another 3,347 new positive cases that have been identified. Again, 3,347 overnight. Yesterday on paper, we put out 2,316. So the statewide total of positive tests now stands at 16,636. Sadly, I must also report that we have lost since yesterday another 37 New Jerseyans to COVID-19 related complications, again over the past day. Yesterday, in our paper release, we had put out that we had lost 21 blessed souls. So that's a combination of 58 over 2 days. The statewide total number of deaths is now 198. Each one of them a precious life lost. God rest their souls. You may have heard that there is clearly a challenge at the Lakeland Health Center in Passaic County. I've instructed, not that she needed it, Judy and her team, to give full support to Mayor Dan Mahler to get to the bottom of that. Clearly we saw in Washington State, and we're living it in our own reality right now, long-term care facilities are a particular area of concern and focus, and we know that lots of folks out there are worried about moms and dads, grandfathers and grandmothers who are in facilities around the state. We're doing everything we can to as aggressively get out ahead of this as fast as possible. We also lost New Jersey National Guard Captain Douglas Lynn Hickok this weekend. He was a drilling guardsman and physician's assistant, originally from Jackson, New Jersey. He was a Pennsylvania resident at his death and passed away in a Pennsylvania hospital. And while he will not be counted among our state's COVID-19 losses, this loss hurts no less because of that. I just got off the phone with his wife, Marianne. Bless her and bless them. I sent her and Tammy's and indeed our entire state's condolences to her and their children, Alexander and Robert, who I spoke to with her, as well as Noah and Chandrea and their family. Captain Hickok is prominent in our thoughts, as is every New Jerseyan we have lost. Each of their lives was precious, and I know their memories will be precious, and I hope they are a source of strength to their families and friends at this time, and may God bless them all. These numbers, as I have said before, never get any easier to report. They're never going to be easier until that number, frankly, stands at zero. But I also shudder to think about what these numbers would be had we not taken the strong stance we have as it pertains to social distancing. As I have said before, social distancing is absolutely necessary for us to slow the spread of COVID-19, to flatten the curve of new cases, to save lives, and to protect the ability of our healthcare system, one of the best in our country, if not the world, to help those who need the help the most. We try every day to hammer this point home, sometimes with levity, sometimes by standing up to those who have failed this lesson as examples. And before we go to questions today, I'm going to ask Pat to weigh in with a couple of the overnight enforcement news, but we'll do that in a couple minutes. I want to make this point. And by the way, as I mentioned, I spoke to Captain Hickok's wife, Mary Ann, and 2 of their 4 children, and she asked me literally to make the point, when we say stay at home, we mean stay at home. And she went through a number of examples where people were hanging out, going to the beach, flaunting the clear mandate that we have put in place. And that will not allow us to achieve what we must achieve, which is to flatten this curve as fast as possible, and therefore take the pressure off our healthcare system and be able to deal with each one of these folks who are sick in the very best way possible. So I've tried different ways. Today I want to do it with a graphic, and maybe you can pull this one up. This chart, which is, I think, the chart on the left over here. There we go. This chart is built from the actual data that we have received on the ground. It is our best understanding of how fast COVID-19 would have spread across our state without social distancing, as counted in the number of hospitalizations that would have risen. Without social distancing, we would have expected to hit our entire statewide capacity for intensive care unit beds on Wednesday. In just 10 days from now, we would be expecting to exhaust our entire supply of available hospital beds. Eventually, the number of residents needing ventilators would not just far exceed the number of available ventilators, but our entire availability of beds. And all this assumes that just 5% of all cases would require hospitalization, and only 1% would eventually require a ventilator. This chart is the nightmare scenario that we are desperately working to avoid, and that we are urging every New Jerseyan to help us avoid. This is what we mean by flattening the curve, and why we have taken all the steps we have taken since January. This is why it is absolutely necessary for everyone to stay in unless you need to be out, or unless we need you as part of our response. This is why we're going to continue enforcing the prohibition against gatherings and parties as stringently as we have. And again, you'll hear more from Pat in a few minutes on that. And even with all we are doing, we are preparing for the eventuality that we are going to need extra hospital beds. Judy will talk about, if you can go back to the chart, if that's okay. I don't know who's got that. Just if you can't see the actual data there, let me just tell you what the blue line are persons hospitalized. That's the top line. And it comes in at just under 80,000 at a peak which is essentially in early to mid-May. And you have at the same chart current capacity of hospital beds, Judy, of about 18,000. And so you could see the mismatch that is before us unless we succeed at social distancing. There's literally no amount of effort or energy we can apply to that chart that you're looking at that will close the gap between what we will need and what we have. Literally, there's nothing we could do if we did everything within our power. So the absolute number one weapon at our disposal is the one that we've been pounding away on day in and day out, and that is stay at home, practice social distancing, period. And again, Judy will give you a little bit more color on what might possibly be achieved. Let me just say what's underlying that really graphic chart that you see behind me at the moment. It assumes no social distancing. It assumes that infections double every 6 days. Hospitalizations among the infected is 5%. ICU among the infected, 2%. Ventilator use among infected, 1%. Average length of stay in a hospital, 7 days. ICU length of stay, 9 days. Ventilator length of stay, 9 days. There's really, and Judy can tell me if she disagrees with this later, there's really only 2 variables there that we could control. One is social distancing, and then that in turn is the infection doubling time. The more of a social distancing reality that is fed into that model, the longer it takes for cases to double, the flatter that curve becomes. So we can then go to the hospital systems. This is exactly why we are working with our hospital systems, and here's a map of our acute care hospitals and health systems to expand their bed capacities in their existing facilities and to reopen closed hospitals to bring online an additional 1,300 plus beds. And that's why we have partnered with the U.S. Army Corps of Engineers to stand up 3 regional field medical stations capable of adding another 1,000 beds, the first one of which, Pat, I believe will be up and running by the end of the week.
That's correct, Governor.
So looking forward to that. I was back and forth this morning with the likes of Bob Garrett at Hackensack, Barry Ostrovsky at Barnabas, Kevin Slavin at St. Joe's, but also the chair of the Hospital Association, Mike Marin over the weekend, Kevin O'Dowd, and others over the weekend. It's why we've put not just beds, but it's why we'll put the call out to retired healthcare workers, among many others, to return to service to help us. And I thank the many volunteers who have already stepped forward. As of right now, we have had 3,611 individuals respond to this call, and we're incredibly grateful for their selflessness and patriotism. I welcome anyone else with prior medical experience to visit the website you see, covid19.nj.gov/volunteer, to join our army against COVID-19. And it is why I have turned my focus in my ongoing and daily discussions with the Trump administration to our dire need for more ventilators. This is right now concern number 1. Following a number of conversations, and this, as you can imagine, given the weekend, we had a flurry of them, including a couple with the president himself, with the vice president. We just got off a video transmission with the president and vice president and their teams. But after all of this back and forth over the past number of days, I received word last night that a shipment of 300 ventilators from the Strategic National Stockpile is on its way to New Jersey. This is welcome news, and we are grateful, and I thank the administration. But to be absolutely clear, this is far, far from what we ultimately will need. I am going to continue advocating constantly for more, and in addition to that, turning over every stone we have both in this state and our networks around the country and around the world. We know that our hospitals are quickly running toward full ventilator capacity. We are working with them to ensure the supply given what we know we have in state and what's on the way. Even knowing this, we are working with our hospitals and FEMA to allow them to co-vent or have 2 patients connected to the same ventilator. This is a necessary step that will buy us precious time. This is real life, and this is life and death. We need more ventilators, and I will continue to say these 4 words in every phone call I have with the president, vice president, and the administration until, God willing, we get them. I just repeated them on the video call we just had. Along with everyone up here, I'll keep fighting for the equipment we need, whether it be more ventilators or personal protective equipment. And through state procurement, millions of articles of PPE will be coming to New Jersey for distribution this week. We continue to accept donations of PPE through covid19.nj.gov/PPE donations. That's covid19.nj.gov/PPE donations. And I would like to I want to give a shout out to, again, our corporate citizens have been huge. I want to give a shout out to Sherwin Williams, who contacted me over the weekend to report that they'll be donating an additional 2,500 N95 masks and 1,000 gloves on top of what they have already done. Tammy and I hosted a call this morning with a whole range of philanthropic and corporate interests to repeat the need for PPE and other ways that folks can participate. I'm looking forward to a call later this afternoon with the Johnson & Johnson folks. Again, it takes a village. We can't do it all on our own. Again, I hope to give a fuller accounting on PPE in the next day or 2, so please bear with me. But together, as I said, as New Jerseyans, our mission must be to flatten the curve. We need you to do your part and take the necessary steps so you don't land on any graph. Switching gears, a quick announcement on testing. Tomorrow, Tuesday, March 31st, the Bergen County College drive-through site will be open beginning at 8 a.m. for all residents, again, exhibiting symptoms of respiratory illness. Again, you must be symptomatic to receive a test. The PNC Bank Arts Center will be closed tomorrow. Regardless of where you live, if you are exhibiting symptoms of respiratory illness, call your primary care practitioner and they can assess whether you need to be tested for COVID-19 and if so, where you can be tested. The Bergen Community College and PNC Bank Arts Center sites are public mass testing sites operated in partnership with FEMA. And a list of all public testing sites is available, again, at covid19.nj.gov. But tests are available elsewhere and in every region of the state. I also encourage you to visit covid19.nj.gov to take a self-test. There's a symptom page in that website. I encourage you to go there first, perhaps, if you're wondering yourself whether or not you are exhibiting symptoms. Also, I want to thank Senator Joe Cryan, who reached out to me earlier today with Judy, and also Senator Nick Scuteri. Union County's drive-through testing site is opening to all frontline healthcare workers and members of law enforcement, fire personnel, and EMTs from across the state, not just from Union County. If you are experiencing symptoms, again, you've got to be symptomatic and believe you need to be tested, visit UC, as in Union County, ucnj.org for information on making an appointment. This site is open 6 days a week, again, to all frontline workers, and I thank our brothers and sisters in Union County for doing this. I want to actually hold up an exhibit I held up the other day. This is now an expanded list of all the testing sites in the state. So I would just say, with all due respect to some of the stuff you may read about testing, we completely understand the enormous demand of folks to want to get tested. This is a time of high anxiety. We get that. And we also appreciate the fact that folks who are in the worried well are stepping aside overwhelmingly to allow folks with symptoms to go forward and get tested. That's the way it should be, and that's been our focus from day one. We made the decision right out of the blocks, and again, we've been as aggressive as testing symptomatic people as any state in America. We made the bet, particularly limited federal resources. Would we like to be South Korea? Would I like to have unlimited specimen collection material? Would I like to have all the healthcare workers at my disposal? Would I like to have tests that turn around in 45 minutes, which I think we will have at some point sooner or later? You betcha. But in the absence of all of the above, in a limited supply reality, particularly from the federal government, you got to pick your spots. And there is no doubt, for obvious reasons, by the way, that testing symptomatic people is the place to hang your hat, and that's where we have chosen to hang our hat. Obviously, if somebody's sick, we want to make sure they know whether or not they've got this virus or not, for their own well-being, for their own peace of mind, and also for their own health care if, in fact, they've got it. But it's also the highest quality data that the people to my right need to allow them to try to get our arms around this virus and project where it's headed. So with all due respect to the perfect world, which we do not have, I don't control the amount of federal supplies. I wish I did, but I don't. The reality is, given what we have and recognizing there's an overwhelming demand and interest in getting tested, which we completely understand, let's make a meal out of testing symptomatic individuals, addressing folks who are sick. For obvious reasons, that makes sense, but it also gives the epidemiologists and the other healthcare professionals the highest quality data that they need to be able to get our arms around this. Bless you, into your arm, I hope. I also have a few updates to provide. First, speaking of the PNC Bank Arts Center, I am proud to announce that PNC Bank has signed on to the mortgage relief plan that we unveiled on Saturday, meaning more homeowners financially impacted by this emergency will be able to take advantage of the 90-day grace period on their mortgage payments. We urge those homeowners to work, if they've got a mortgage from PNC Bank, to go directly and work through PNC Bank. And likewise, if you've got a mortgage with any of the banks that we've listed, deal directly with them. Second, pursuant to the executive order I signed Saturday mandating daily reporting by our healthcare facilities of their PPE inventories, ventilator inventories, and bed counts, we have established an online portal for that reporting. We have opened our online portal for all impacted healthcare facilities at report.covid19.nj.gov. That's report.covid19.nj.gov. And as we committed on Saturday, we do intend to make some of this information public. My guess is later this week would be my guess, Judy. Attorney General, I think we may have jumped the queue on this slide if we want to go back a couple. Attorney General Gurbir Grewal and Acting State Comptroller Kevin Walsh, in partnership with the U.S. Attorney Craig Carpenito, have announced the formation of a joint federal-state task force to investigate and prosecute misconduct ranging from unlawful hoarding of medical supplies and price gouging to charity scams and procurement fraud, among other unlawful misleading activities. Residents may anonymously report any instance of these unlawful practices at the numbers behind me, 866-720-5721 or disaster@leo.gov, disaster@leo.gov. Make sure you make note of that. I also wish to amplify an announcement made Friday by the Department of Human Services that over the next 2 months, $70 million in additional SNAP or food stamps benefits made available by the federal response bill will be given to qualified New Jersey beneficiaries to help them with the purchase of groceries. These supplemental funds will be loaded directly onto a family's EBT card. And the Division of Alcoholic Beverage Control is issuing guidance to allow breweries or brew pubs to provide home delivery to their customers. Home delivery has been prevented because of a ruling that ABC issued last May. Today, ABC has decided to relax that ruling and allow for home delivery. Also this morning, we issued an administrative order updating and clarifying Executive Order 107, specifically pertaining to which businesses may be allowed to operate during this emergency and the ways in which they can operate to ensure social distancing. We will allow auto dealerships to conduct online or remote sales and authorize dealers to deliver vehicles directly to their customers or to arrange for curbside or service lane pickup at a dealership. We also made 2 clarifications. The first allows realtors to operate and to show houses to prospective buyers, but only on a one-on-one basis or to immediate families, but continues the current prohibition on open houses. The second clarification reiterates that golf courses are closed and will remain and should remain closed as recreational businesses. In accordance with the guidance released over the weekend by the Federal Department of Homeland Security, we will allow firearms retailers to operate by appointment only and during limited hours to conduct business which under law must be done in person. Again, we are doing this in light of the federal guidance published Saturday night, which includes these retailers as part of critical infrastructure. It wouldn't have been my definition, but that is the definition at the federal level, and I didn't get a vote on that. We will continue to enforce all of our gun safety laws, and all gun owners are reminded of the need to keep their firearms locked in safe storage, and anyone who sees a firearms retailer acting in violation of this order should report them through covid19.nj.gov/violation, and law enforcement will respond. Finally, I wish to close by reiterating the words I said yesterday regarding the travel advisory the CDC announced on Saturday. We're already living what the CDC is calling for, and their advisory does not impact what we already have put in place to protect our state and our residents. My stay-at-home order remains firmly in effect. Unless you are absolutely needed to go out, or unless your job is critical to our response, please, please, please stay home. We will get through this. There's no question in my mind. But we'll get through this more quickly and stronger if everyone, all 9 million of us, does our part. Don't think that because someone else is staying in that you don't have to. You got to do the smart thing. You got to do the right thing. That gives me a chance before I go to Judy. Pat, tell us what the overnight enforcement looked like, and also you wanted to clarify the amount of members of law enforcement who were exposed or had the coronavirus.
True, I'll start with that. And on Saturday, I had indicated basically just the wrong information. I had overstated the positive test. There's actually 3 categories that we're providing now daily. And as of today, to clarify for the record, there's 288 law enforcement officers tested positive. 2,477 are at home in a self-quarantine, and 618 are out for other reasons, whether that's sick or they're out injured. These, if you want to, we can report them. And the reason why we're keeping those is to keep operations to be planned tactically and operationally. If a squad or a station or a police department needs assistance, we want to plan for that. With regards to the overnight, there was an incident in Harrington Park where a male subject was arrested for driving under the influence. He was charged with eluding, obstruction, and driving under the influence. While being processed, he coughed in the direction of the officers and claimed to be COVID positive. There was also an incident in Lakewood. Lakewood Police Department responded to a gathering of 40 to 50 people. It was a bat mitzvah. It was a celebration that resulted in a child neglect charge, as well as the charge for violating the governor's executive order. In Bridgeton, there was a gym that had an Herbalife session going on. That runner of that gym was charged, and in Woodbridge, there was a barber shop that was open, and that subject was charged. So over the time period that the executive order restrictions have been in place, there's been 70 compliance issues, which has resulted in, to date, 34 indictable offenses. Thanks, Gov.
Thank you, Pat. The Attorney General is not here, but I want to ask my colleagues, beginning with you and maybe Jared, I would like for us to consider the heft of the penalty that one has to pay in these times in some extraordinary fashion, particularly someone who willfully. It's one thing to be ignorant, although the patience for ignorance is about zero, given we've been pounding away on this every which way, morning, noon, and night. But for somebody to willfully ignore this and put someone else's life at stake, and you're doing it, by the way, if you have a gathering, you're doing it in a more benign way than if you cough on somebody and say you've got coronavirus. But in both cases, you're wrong, and you're out of compliance, and it's illegal behavior. And I want to, if anything, tighten the screws on the price that those folks will pay. With that, with lots to talk about, with color on the cases overnight, bless the fatalities, as well as some of the charts that I already began to refer to, please help me welcome the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon, everyone. As I've mentioned previously, the department has been modeling when the peak of COVID-19 cases will hit our state and when we expect this surge to be at our hospitals. This is directly related to the availability of hospital beds and the resources needed to care for our patients. That's medical surgical beds, critical care beds, and things like ventilations. We're using the CHIME model. The CHIME model was developed by Penn Medicine. It stands for COVID-19 Hospital Impact Model for Epidemics. It projects how many patients will need hospitalizations, and it projects the resources that are needed. So just to level set before we go over the charts, right now, if we did nothing, we have 18,000 medical surgical beds and about 2,000 critical care beds. If you look at the chart with the greatest peak, the highest peak, that is the chart that we're calling pre-mitigation. That was before all of the mitigation interventions. In other words, we did nothing at all. Let people go about their lives as they knew it. I think you can see by looking at that chart, the peak is the hospitalizations. We would have a little bit shy of 80,000 hospitalizations, certainly far higher than the available beds that we have. The ICU capacity would have to have 40,000 beds. And you know, if we did nothing, we would have 2,000. So we show this because it really points out that the real only tool we have in our toolkit is social distancing and the impact that it can have. If you look at the second chart, this identifies the impact of social distancing at 31%. Now, you might ask, why did you choose 31%? Well, that's in the literature of the compliance rate of social distancing by history, by other epidemics. We've identified the infection doubling rate. And remember, this is a point in time. We run this a number of times a week because it changes. The infection doubling time, the rate of new cases doubling, every so many days, we've identified that as 6 days. The hospitalization rate among infected individuals, we've identified at 5. The ICU, the number of individuals who would then need an intensive care bed, is at 2%, and half of them would need a ventilator. And then you factor in the average length of stay overall of the hospitalizations, and then the ICU length of stay and the ventilator length of stay. So if you look at the chart with 31% social distancing, you can see that we reach our ICU bed capacity on April 11th. That's pretty soon, right? Well, this assumes that we've done nothing. I think I reported last week that we asked all of the hospitals to double their ICU critical care capacity. We asked them if they had 10 critical care beds to move it up to 20, if they had 40 to move it up to 80. It's a 100% increase. If you also look at this chart, you see that we reach our all bed capacity on May 8th. Sorry, May 8th. But you also see the delta between the existing beds of 18,000 and the requirement of over 30,000. So if we were doing nothing with our hospitals, no planning, we would be short. But what I can report is that we are increasing our critical care beds. And we are increasing the availability of additional medical surgical beds for lower acuity patients. In discussions with the CEOs, they are prepared to accept the fact that the primary hospitals will become large critical care units, and that we will be decanting, and this already started, we will be decanting to lower levels of care into field hospitals, opened general hospitals that have been closed within the last 5 years, and increasing our additional bed capacity between 1,500 and 2,000 beds. Additionally, we're looking at dormitories and hotels to be able to take care of all of our patients in the safest way possible. So this modeling relies on the impact of social distancing, the number of positive cases reported daily, the number of cases in our hospital and their length of stay, in critical care and then medical surgical, along with the number of positive cases and cases under investigation. We're assuming that every case under investigation is a positive case. It's probably not 100%, but it gives us a marker. So I assume the next question you're going to ask is, well, if the social distancing is the only tool we have in our toolkit, what should that percentage move up to be? Well, we know at 50% we have more than adequate beds right now. But we also know that 50% is pretty aggressive social distancing. So the real number is probably between 40 and 45%, and may not be that much of a reach considering the compliance that we're assuming right now. So this is a projection. It's based on the available data that we have. It's a point in time. More beds will be brought online. We believe the infection doubling rate will increase. We believe that social distancing percentages will increase. And we believe we will significantly flatten the curve by the initiatives and the interventions that we have already initiated. As the governor mentioned, today we're reporting 3,347 new cases for a total of 16,636 cases in the state. And sadly, new deaths have been reported to the department. They number 37. 4 of those deaths are associated with long-term care facilities. I have shared with you repeatedly our concern for long-term care facilities. Right now, 73 long-term care facilities report at least one COVID-positive case. In long-term care facilities, we have identified approximately 34 deaths associated with COVID-19. However, in long-term care facilities, we have reported a total number of deaths of over 80. It's about 81 or 82. I point that out to share with you that every reported death in a long-term care facility is not necessarily due to COVID-19. The county breakdown of new cases is as follows: Atlantic, 5, Bergen, 249, Burlington, 28, Camden, 36, Cumberland, 1, Essex, 280, Gloucester, 17, Hudson, 289, Hunterdon, 10, Mercer, 45, Middlesex, 171, Monmouth, 134, Morris, 74, Ocean, 84, Passaic, 124, Somerset, 47, Sussex, 9, Union, 226, and Warren, 10. I also am reporting that another of New Jersey State Psychiatric Hospital employees has been affected. There is one staff member at Ancora that tested positive for COVID-19, and we now have one resident in a psychiatric facility testing positive. As of the date of this morning, of the major labs sending us their results, and we are getting results now from over 95% of the major labs, there have been 40,806 tests performed, of which 15,582 have tested positive, for an overall percent positivity rate of 38.19. So that ends my report. We believe that our social distancing mitigation interventions, our ability to slow down the rate of the doubling of the infection and the increase in the number of beds that we're bringing online will prepare us to handle the surge that we're expecting imminently. Thank you.
Judy, thank you. A couple of things before we go to questions. I mentioned on the video call with the President and Vice President, and I mentioned it again in a private conversation I just had with Speaker Pelosi, and I meant to say this earlier, as significant as the bill that the President signed on Friday was in terms of direct help to everyone from folks who are out of work to small businesses, hospitals, transit systems, and certainly to state government. As we've said all along, we're going to need more. We're going to need a lot more help. And our ability to understand both the rule book by which the money is dispensed that was signed by the President last week, as well as planning for next steps, which is why I was on the phone with Speaker Pelosi, are incredibly important. Secondly, Judy, you mentioned back to health, 73 long-term care facilities have at least one positive. Just to remind everybody again, if I get the denominator right, it's 375
That's right.
in the States. That's about 20%, just under 20%. And that number, if you've been listening to us, end of last week was, I think Thursday was 15. So that number has gone up, and that's not surprising, but it's an area of, I know, great concern. The counties, the top counties I usually read out after you finish of total cases: Bergen far and away number 1, Essex number 2, Hudson 3, Union has now jumped to 4th, and Middlesex fifth with a couple right behind them. Could we put the charts back up, please, the two graphs side by side? So, folks, this is going to be, I'm going to do my best to implore, to channel Winston Churchill when he took over as prime minister on May 10th, 1940, when it felt like all hope was lost for everybody in Great Britain, and he gave his first speech 3 days later and basically said, I have nothing to offer but blood, toil, tears, and sweat, but at the same time implored his countrymen to hang in there and collectively come together and do what many thought was impossible or beyond them. And that's what I want to use as a launching off point. Look at these charts. What this is saying basically is very simply, if you have average social distancing compliance based on past epidemics or pandemics, you can reduce the peak of the curve by about 57%. So in the chart you're looking at, you're just under 80,000 if we had let this go unfettered, and you're bringing it down to just about 35,000 with an average, relative to history, an average social distancing performance. And you still see, as Judy has pointed out, you still see relative to today, and I'll focus on total hospital beds if it's okay with you, because it's the easiest the easiest lines to read. The difference between that blue chart on the right and the red line going straight across is about 17,000 beds. So that's an average relative to history performance on social distancing and staying at home. I implore each of us, we're not an average state. We're not an average 9 million people. This is Jersey. How many times in the past have we done what folks said was impossible? We have lived our lives punching above our weight. We've lived our lives defying the odds. No state has more attitude or character. No state has been smarter over the years in figuring out what seemed to be the impossible and yet getting there and achieving nonetheless. So I ask each and every one of you who are watching to look at these charts and ask yourselves, are we average or are we a lot better than average? We are a special place. We can crush the top of that curve if we act as one. If each one of the 9 million of us does our part, including the little things. No more knucklehead parties or gatherings, Pat, please. Not that I know you're not sponsoring them. No more aberrant behavior. We have got to stay home. We have got to stay away from each other. We've got to set a bar in terms of our social distancing that no other state has ever set before. And by the way, who's to say we can't? Remember, we are New Jersey. We can do this. We must do this. Now, Judy and her team will find every available damn bed they can find, from opening wings to opening hospitals to opening with FEMA and the Army Corps full pop-up field hospitals to converting dorm rooms and hotels. I know that she and her team will do their part. We've got to do our part. We got to crush that curve even further. We got to stay home, stay away from each other, do the little things. If we do that, we will remind everybody how special, unique our state is. We have got this within us, folks. We have absolutely got this within us. And please, God, let's not let it slip to the left. We want, if anything, that curve on the right to go to the right, to show that we can flatten that top of that blue line. As Judy works to raise that red line up, our job collectively is to bring that blue line down. And we will do this because nobody is like the great state of New Jersey. With that, let's take some questions. Elise, we're going to start over here. Dante Colucci's got the microphone. I can't tell if he's got a glove on. Do you have a glove on? You should have one on, Dante.
Okay.
Elise, you're up.
Good afternoon.
We can barely hear you. Dante, you got to get closer.
Good afternoon. For these first two questions, they come from Daniel Munoz from NJBiz. He asks, for the lending agencies that your administration has no control over, such as Freddie, Fannie, and FHA, How can you get them to come on board, or is that just not possible as far as the mortgage arrangements? And his second question, he says you called for a stay on rent increases and for banks to offer some kind of credit card relief. For the former, how would you handle landlords that are still increasing their rent? And for the latter, how are you going to get financial institutions to sign on to that? And my own question is...
Those are both Daniel's?
Those are Daniel's.
Okay.
Yes.
Tell Daniel we miss him, and we'll answer his questions as best we can.
My own question is, when do you expect to deploy ambulatory surgical center equipment, and when do you expect any decision on co-venting?
On what?
Co-venting, co-ventilating?
Okay. Matt Placken is with us. I want him to help me out here. Again, we added PNC Bank, which I think is a great move to the list of financial institutions that are compliant with the mortgage, the 90-day mortgage window. Matt, on the lending agencies such as Freddie and Fannie, what's the answer there for Daniel?
So they have their own policies. They put out guidance actually before the CARES Act, and then it was codified in the CARES Act. And we have obviously we'll be working with lenders who issue federally backed loans. These policies or this initiative that you announced, Governor, on Saturday affects loans that are not federally backed.
And on landlords who continue to raise rent, they can hear from me. I'll use the bully pulpit. We are not happy. We are quite displeased with that. But what latitude, either with landlords that continue to raise rent and or credit card companies who may continue to charge late fees and or raise their interest rates?
So we're reviewing all options with respect to other forms of lending activity. We're working in a consortium of states, both regionally as well as with California. You've obviously implemented an eviction and removal prohibition for anyone who would take action against a tenant, but we're exploring all options with respect to those other forms of activity.
Excellent. So you'll report that, at least back to Daniel. On getting equipment from ambulatory and outpatient, that is happening, I believe, is it not?
Yeah, we're encouraging all ambulatory surgery centers to send in their PPE and also their anesthesia machines. There is a possibility that anesthesia machines with a certain implementation of certain valve would be able to be used as ventilators. So we're collecting that now. I don't know how much we've collected. It's probably not as aggressive as we would have liked.
And how about co-venting?
This week, a medical team from FEMA is going to be visiting New Jersey, and we're going, with the Hospital Association, do a video education and training session for physicians to share with them what they have to do to co-vent.
And this
We
is
cannot predict when.
Please, go ahead.
Sorry, we could not predict when that might occur. If our social distancing improves, for example, to around 45%, we probably will never have to use co-venting. So we're just keeping an eye on it, and we're just going to be prepared.
Could we put the charts back up? I apologize. The problem is, as Judy knows better than any of us, we just can't count on that. That's why I've just given a go, fight, win. The extent to which we can smash that blue line on the right down meaningfully, we have a different reality and a different set of choices, but we can't count on that. I'm counting on it, and I know what we're capable of, but the fact of the matter is we have got to expand capacity and take steps that are unusual. I think Pat used the phrase, it's a train the trainers, right? So this is the Department of Homeland Security as well as part of this, along with FEMA. This is a video. This is how you do it, and do it safely. So thank you.
And they're
Dave.
also going to be on site. The docs will be available to travel to hospitals that want more face-to-face education.
I've interrupted you twice today, and
That's okay.
I tried never to do that, so I apologize. I also meant to say this earlier. The president and vice president today spoke about Abbott Labs coming up with a new short-term turnaround testing reality. I've said in several of our sessions of late that, we're testing, and that's the right place to start, symptomatic folks. in a perfect world, if we were South Korea and we had all the federal support that we would have hoped for, that would look differently. The fact is, it's not just the stuff you need to collect the specimen, it's healthcare workers, it's personal protective equipment, both of which are in short supply. One more time, healthcare workers and our first responders are our heroes right now. And I meant to say this just because you reminded me with the fact that they were coming up actually to demonstrate. If something like this Abbott test were to get approved and become mass available, or some other testing regime like that, all bets are off in terms of that fork in the road reality that I've outlined before, where at a certain point we're going to have to make tough decisions between, do I put more resources into testing, which I know folks want, and they want to know whether they've got it or not, I don't blame you, or do I have to take in a limited resource world coming out of the federal government and a limited pool of healthcare workers to apply all of that to care. I'm really encouraged by the amount of folks who have answered our call to arms, over 3,600 of them, and God willing that number goes up so that becomes a less of a constraining factor. I think it then would come down to materials. I meant to say that earlier, apologies. Dave.
With regard to the co-ventilating issue, I believe, Governor, you had said that we're getting 300 from the national stockpile, the strategic reserve. Where else can we possibly get ventilators? Where else are we looking for more ventilators? Commissioner, perhaps you could talk a little bit about how effective co-ventilating is. Is it as good as a single ventilator? Does it actually work? Is there a percentage breakdown that we know of that this is effective? And with regard to the anesthesia machines that can be transformed, I guess, do we have a sense how many anesthesia machines we have in New Jersey? How long does it take and how effective is it to switch them over to ventilators? And then is that going to cause another problem with a lack of anesthesia machines?
May I, is that all you got? I just want to make a general comment and then maybe ask both of you to come in here. We got 300 ventilators coming at us out of the strategic stockpile, and I'm grateful for that. So I don't want to look a gift horse in the mouth. We need it, and we need it desperately. We'll take it. I think our total ask, Pat or Judy, was 2,300 out of the strategic stockpile.
I think it was 20.
So we would have still on balance an ask of 2,000. And I look to Pat because Pat, you've got an order to buy 2,000 as well, I believe. So we've got, and that's some number of weeks away. Is that correct?
That's correct, and we do have, I spoke to the regional administrator at FEMA too, Tom Van Essen, about that order, as well as any additional on that air bridge program that was discussed today, Gov.
So again, we're trying to buy them as well on the open market. Judy, do you want to talk about efficaciousness of co-vent versus single vent and also anesthesia machines? Yes.
We're definitely going to get 2,000 more, or we're trying to get 2,000 more?
Trying. We're trying to
Okay.
buy them as well as a separate matter. So those, I was transposing two different realities. We have an ask for a balance of 2,000 more from the federal stockpile. We also are out trying to buy on a parallel basis 2,000. And if we end up with too many, that'll be a mistake I can live with. Please.
Yeah, just on the vents, what we're saying is we want to move from 2,000 critical care beds to 4,000, and we want every critical care bed to have a vent. If that does not occur, then you go to co-venting. Apparently the efficaciousness is similar. Obviously, there has to be some training. That's why we're bringing the team up to speak directly to our physicians. They sent me a number of pictures and information. I haven't sorted through all of it, but the bottom line is that the FDA has approved co-venting. So we believe it's efficacious, and we just want to be prepared. As I've said in prior press conferences, we are definitely going to be preparing for the worst. We're hoping for the best. And this is just one other thing that we're just going full steam ahead to make sure if we need it, we will know about it.
How about anesthesia?
We have, even in a hospital, if you have a hospital with 10 ORs, they usually have 2 anesthesia machines per OR in case one malfunctions. So we have 71 hospitals. We have many surgical suites. And we have almost 1,000 ambulatory surgery centers. So we have thousands of anesthesia machines. So we have backup. So our backup has backup. Apparently, the transformation of an anesthesia machine from a biomedical engineer, is a 24-hour situation. It's not long.
Governor, any chance that operations will change at the state's gas stations in light of the social distancing recommendations, temporarily allowing people to pump their own gas? And also in the field hospitals, when you say lower level patients, I may have worded it differently, will these be COVID patients that have lesser symptoms or non-COVID patients?
I'll take the gas stations, and that we've given no thought to changing that for the time being. Field hospitals?
Okay, so let me just tell you a little bit about the field hospitals, because we're all learning together on this. And the first one is going up in Secaucus. The floor plan shows 250 beds. They're in cohorted areas, but there's not walls between them. So we have to be careful about the types of patients we put in there. The lower acuity patients are still patients that perhaps deserve to be in a hospital, and the way you look at whether a patient should be in the hospital is the severity of their illness and the intensity of their service. So if a patient fulfills both of those criteria as being admitted to a general acute care hospital, they may be appropriate for the field hospital. The field hospital overall, though, will have the appropriate oxygen and suction and electrical power to allow us to put in ventilated patients as well. We've chosen to keep the intensivists, the pulmonologists, the critical care nurses all in the general acute care hospital working together as a team, because they're going to be so valuable to take care of the very, very sick and move the lower acuity patients into field hospitals, and even a step down from there if we have to use hotels. So it's definitely the continuum, but these would be patients that at the field hospital that would be in a hospital.
By the way, even while you're pumping gas in the supermarket, at home having dinner, practice social distancing. Please.
Do we have an estimate of how many ventilators or anesthesia machines we will be getting from these ambulatory surgery centers? And then, Governor, construction workers are still at work. However, their social distancing requires using commonly one porta potty per 30, 40 guys. Is there any consideration to bringing that to a close, implementing any different procedures?
Yep. Do you want to start with the...
I think it's important for you to know that we're doing a full inventory of every ventilator we have in New Jersey. There's universal ventilators, there's adult ventilators, and there's pediatric ventilators. And we are doing a complete inventory of them. And then we're doing a complete inventory of ambulatory surgery centers and their anesthesia machines, and anesthesia machines in all of our hospitals. So remember, elective surgeries have been curtailed, so we can redeploy even within our own hospitals. I have the first part. We don't have all of the inventory of the ambulatory surgery centers yet, but we're pretty close to a full inventory on every single ventilator in our acute care hospitals. And we're moving towards the ambulatory surgery centers. And then the inventory of our anesthesia machines in our hospitals is near complete as well.
We are right now staying with where we came out in terms of construction. We have looked and will continue to look at so-called non-essential construction. Potentially, but at the moment we're staying with where we are. We're asking everybody to the very best of their ability to practice social distancing as much as they can in all walks of life, including construction. Do you have questions, ma'am?
Yes, I do.
Hold on a sec. You're way back there. I got to put my glasses on.
for the commissioner. Have any hospitals run out of ventilators, and are any close?
None have run out of ventilators. We have gotten a number of calls. I can tell you one hospital last week put 33 patients in a 24-hour period on ventilators, on a ventilator, and then they call us and say, "I'm going to run out," and we've been able to fulfill their needs as they've called. We have a small stockpile centrally. We give them out judiciously based on prioritization and where we see the increases in the incidence of disease. So right now, no one's run out, and we do expect that we'll be moving ventilators throughout the state because of the incidence being so smaller in the south part of the state. We're moving things to the north part of the state.
You good? One more?
I had a couple more, sorry. And speaking of long-term care facilities, you moved really quickly to close St. Joe's. Can you talk a little bit about the decision-making involved in, for example, Family of Caring in Montclair or Lakeland, who had far more deaths associated with them? Like to the families of people in those places, what would you say?
Sure, and that's a great question. The decision-making for St. Joe's related not only to their patients, but to their staff. The decision was made when the sister called us and told us that it was only the sisters that were taking care of the residents because the staff were suffering from respiratory illness, and 10 or 12 did not come into work, maybe appropriately so. So there was not only an outbreak, there was also lack of staffing. I hope to reopen that. We're making sure there's a heavy cleaning and decontamination. We need their 200 beds. It's, like I said last week, it has a strong history and heritage and tradition of taking care of patients in that area. So we hope to reopen that. We have to make sure we have the staff to do so. You've mentioned a couple of other long-term care facilities. We're monitoring every one of them. And if they do not have the ability to cohort their patients, in other words, isolate them in a certain wing so that the other patients are safer as a result, we might have to take more deliberate action. We're looking at that every day. We're looking at spaces that could accommodate long-term care residents as we try to keep people in the safest possible situation. But it's a struggle, but we're working with them. And we have sent our infection preventionists out to a number of them to work with their staff to move patients around to what they say is cohorting the patients. Did that help?
Judy, if I add at least one, I guess, comment to this, you could also envision, say, a St. Joe's, you and I were discussing this earlier, reopening it and making it much more private, so it's taking it from 200 beds down to a lower number to be able to cordon off folks more effectively. Right?
Exactly. What we want to do is make sure that we have the safest accommodations for the residents of long-term care. They are so vulnerable, and we're concerned.
And the other, which I know you mentioned as it relates to St. Joe's, and I think it's probably applicable to some of the other facilities we're talking about, at the state level, you also have to parse through cause of death, which I know is another X factor here. So let's acknowledge the precious lives lost and keep them in our prayers, and God rest them all. But in particular, you've got some folks with either end-of-life issues or at a minimum comorbidity, and you have to parse through as to exactly what was the cause of death, sadly, right?
Yeah.
So, you good? You're all right? Matt?
So, Governor, yesterday Governor and Commissioner, I just have a couple. So, Governor, yesterday the President called you a, quote, terrific guy, and you yourself have offered some praise for the President, and the administration, I should say. Ordinarily, you'd expect to see the head of the Democratic Governors Association to be going after a Republican president, not praise him at this time. What can you say about the relationship right now? Is this like a Christie-Obama moment after Sandy? And Commissioner, a few things. I'd like you to clarify where we are on hospital capacity. Apologies if you did roll out those stats earlier, but I know that some hospitals are supposed to be reporting that. What can you tell us about where we stand? And also on the pop-up hospitals, are those ready to go? And one last thing on figures. Do we have figures of people who've recovered? I think at some point we said we were going to be releasing those.
I'll take the non-health, non-medical side of the equation here. Let me just say this on the pop-ups. I said this earlier, and I sort of said in passing, the first one I believe we hope to have up and ready to go by the end of the week, right? Is that fair? Okay. I'm not sure about the other ones, but at least the first one at Meadowlands is by the end of the week. Listen, I mean this sincerely. I don't wake up every morning with the choice to say, okay, who's going to be my president today? Do I get X or Y or Z? The president is Donald Trump. The vice president is Mike Pence. There's one federal administration. We need the feds. The feds need us, by the way, as well. And I think if you were a part of the back and forth that we had over the course, I think, of Saturday, when there was a discussion of a travel advisory or a quarantine, I think we all realized that we need each other. I was on with Governor Cuomo and Governor Lamont a whole lot. We were on with the president and vice president and their teams a whole lot. We need them, and they need us. And they are the administration. It's the same reason, by the way, I was on with Speaker Pelosi just before coming over here in terms of war gaming. Where do we go next in terms of the economic support? We deal with the leaders who are in their seats, not the ones who we might theoretically think about. This is a fact, and I have to say, while we still have a big ask outstanding of things like PPE and ventilators, slowly but surely we're chipping away at that, and we won't relent until we get our fair share. Judy, anything else?
I just want to talk a little bit about the pop-up. The first one, at the end of the week, it won't open the end of the week. Tomorrow we have a group of individuals coming to Department of Health that have agreed to be the management, administrative staff. So we're going to work through the logistics of that. They will come with 3-day supply of supplies, laundry, linen, things like that. And then it's up to the state and the Department of Health to make sure that we have backup supplies to run for as many weeks or months that we have to run. And I also want to say, and the Colonel was at the meeting on Saturday, Dr. Eastman, who is the physician in charge of FEMA's response throughout the United States. We had NJHA there, we had New Jersey Hospital Association, the State Police, the OEM, and Dr. Eastman said he had never seen such collaboration. So this is not just a Department of Health pop-up. This is something that, as a group, we're working together on. Somebody's working on procurement. The central command stations working on equipment and supplies, and it's really gratifying to know that you're just not out there alone. That the collaboration through every department is extraordinary. So we expect to start accepting patients there middle of the next week.
Status about where current beds and also how many people have recovered?
Sure. I'll let Dr. Tan talk about the recovery because we talk about that all the time. And it's the statistics obviously are lacking because we don't know people with mild and moderate disease at home who haven't been tested. But what was the question?
I'm just curious. I know some hospitals, you put out the call to hospitals to report their capacity.
Oh, they
where
are, yeah.
So can you report to us
Yeah,
where
we're bringing
hospital
up a
capacity is?
dashboard at the Rock, and they will be reporting all of their beds, their bed capacity, all the beds, what their occupancy rate is. Then they'll also look at critical care and what their occupancy is, ventilators, and what their usage is, whether they have an inventory on hand. I'm looking at Jared because he was involved with the meeting yesterday. There's a whole list, and that dashboard will be updated every day, every morning, after all the hospitals have their huddle. All hospitals every morning have a huddle where they say, what's the day going to look like? How many employees do we need? Did somebody call in sick? It goes on and on. After they have their huddle, they will be reporting into the Rock. And then our collaborating institutions, the level 1 trauma centers, will access that information and start meeting the needs of the patients throughout their region. Did that help? Okay.
Thank you, Matt. John?
First, I have a question from Mike Catalini at the AP. Governor, are you going to direct the South Jersey Transportation Authority to postpone public hearings on its toll increases this week? And if not, why not, given the stay-at-home order? And then I have questions on the ventilators and the curve. That 31% isolation, that still assumes months of at capacity at every level for hospitalizations. Are you, given the aggressive social distancing we're doing now, are you expecting months of at capacity for every level in hospitalizations, ICU beds? And given that, especially with ventilators, we talked about the numbers of beds, the number of ventilators, will we have the number of people needed to run those machines and maintain the care levels, even the care levels you've discussed given the emergency? And the 300 ventilators, that's the total number, not in addition to the 200 we heard about last week from the federal government?
I'm not sure which 200. This is a new 300.
So it's 500 then?
I want to come back and clarify that. But this 300 I know is new.
Okay. And when they come from the federal government, are they assessed and working, and how long does it take to assess them, check them out, make sure they're operational?
Okay. Let me start with Mike's. I'll give you Mike's answer quickly. I've got no insight into the actual hearings and process, but the things that I cared about was we didn't have people gathering, that we had plenty of opportunity for folks to have comment. So I believe this is the case, at least when I was asked my vote. Stream these, no physical meeting, give a toll-free number that with a real person on the other end to take calls, to take people's input, and to extend the period. Those are the three things that I said: stream, a phone number, extend the period, and no gatherings, I guess. And if they met that was my most salient concern. Judy, do you want to hit does this in fact mean you're at months at capacity and implications as well for manpower, and either you or Pat, when these come in, what sort of shakedown crews do we do for the equipment when they come in?
Let me talk about manpower. In our planning, one of our reasons for keeping the highest acuity patients at the acute care hospitals that we have is to maintain that manpower expertise. If we had them running to field hospitals and smaller new hospitals that have opened or nursing home, it would not work. So along with the CEOs, we've decided the highest acuity will be at the main acute care hospitals to maintain the expertise that we need. Intensivists, pulmonologists, CRNAs are going to be extremely valuable. We do expect then perhaps at the field hospitals and the smaller hospitals that the advanced practice nurses, paramedics, physician assistants would be of great help. We're deploying them in different ways through waivers of some restrictions on their licensing. As far as the sustained activity, that's going to be dependent on the doubling rate of the infection. If the doubling rate stays at 6 days, yeah, we'll have sustained activity. If it starts stretching out, which we hope it does, then things will lighten up a bit. Maybe.
And it
Dr.
doesn't
Tan
stretch
can
out
talk
without much more aggressive social distancing.
Yeah,
That's
and
the key.
that does not.
Right.
I don't know, Dr. Tan, do you have anything to add about the epi curve? And she gets into, she way past me on this one.
Again, it's a little early to be able to assess what's happening in real time in the epi curve versus these models, because again, the data change day by day. And as the commissioner had mentioned, the model is based on point in time assumptions that are plugged into the modeling model itself. So again, we continue to monitor these cases, and we have to remember that there are a couple things that are happening with the epi curve. In other words, the number of cases over time, where the horizontal axis is like generally the onset of illness. We've got more testing that's available. We had multiple levels of mitigation, social distancing that were imposed at the same time. So it's kind of hard to tease out how this will actually play out in the actual epi curve that we see.
Pat, real quick on shakedown of the machines.
Based upon all, we've had so many meetings and discussions with regard to these ventilators. The meeting with Dr. Eastman on Saturday, John, and even meetings since, I would imagine at this juncture it would have come up that, by the way, when they arrive, you have to do X and Y, and I haven't heard that in Jersey, and I haven't heard that across the whole country. So I'll clarify if I'm mistaken, but I would imagine that when they get here, that they're ready to go.
Yeah, we're assuming they're coming in fighting shape. Before we break, John, you good?
Colonel, you mentioned Lakewood again today. Over Saturday was a party in Ewing. Is Lakewood more than any other town, or has it just popped up a couple of times recently, in terms of the gatherings?
You know what? I'd have to see what the rock assessment was. I think there was 70 compliance issues. I don't think it would be fair to say more than any other town. I just think that sometimes attention gets drawn to Lakewood and Ocean County.
Although, in fairness, there was a call with the leadership in Lakewood earlier to make sure this is the fastest growing community in the state. And I want to repeat, this is no time. No time is no time, but this certainly is no time to cross wires and start blaming people and blaming communities. And again, if any of that happens, we will be as aggressive as we've ever been. But when you've got a community of that scale and that growth rate, we take that very seriously. We'll want to work with them, and there's overwhelming compliance. I think if you just took snapshots of the streets of Lakewood right now, as we were discussing earlier, you'd see a pretty empty reality. But there have been a few gatherings that we were not happy about. Matt.
Real quick one, Commissioner. Are you aware of any patients who are at North Jersey hospitals being sent to South Jersey hospitals, maybe Virtue? And if so, is it voluntary or mandatory?
Yeah, I'm not aware of any, but we have encouraged particularly systems to look within their own system to make sure that the patients get the most appropriate level of care, and if they have to transfer them, to transfer them. But I don't know any specifics.
You good? Anybody back here, you good? Dave, come over here. Dante?
I apologize in advance for asking this, but there's been a lot of information about a lot of points, graphs, projections. Assuming that we believe the way this is going to play out in this point in time, as Dr. Tan had mentioned, if the peak hits, because Commissioner, you and I spoke last week about 14 to 21 days, probably in the North Jersey area, and then it's going to emanate out. If the peak hits in ICU beds reach capacity 411. Do we have enough beds? Do we have enough equipment? Do we have enough PPE right now to handle what we think will be the surge when it happens as it plays out?
And by the way, do we have enough of a workorforce? You should add to that list
Correct.
as well, right?
Yes, sir.
Do we have enough PPE? The answer is no, and we know that. We haven't had enough PPE for a long time, and I know that I think from the workforce perspective, that's the thing that is concerning them the most. Do I think we'll have enough ventilators? I do. But I'm concerned about the PPE and the impact on the workforce. Is that fair?
Beds?
I think we'll have enough beds. Everybody's working feverishly, and really the extraordinary effort. The hospitals are now moving out as many patients as possible to be able to free up beds in anticipation of the increase in admissions. They're doing it appropriately, and remember, there's no elective surgical patients in the hospital. That freed up beds, so the hospitals are doing, they have disaster plans. They're already implementing. They called their disaster plans into effect quite some time ago.
Please.
You had mentioned that, the whole business about cracking down on wise guys who don't follow the regulations. Knuckleheads, excuse me.
Yes.
In Korea, South Korea, I know they have gone door to door. They've fined people, I think, $8,000 who went out when they were told to stay home, or they put them in dormitories. Has there been any discussion realistically about how to get tougher if people don't follow these rules? Because on the one hand, it sounds like most people are complying, but you've got the knucklehead group that is not.
I don't anticipate we're going door to door unless there's a reason to, and Pat can correct me if I'm wrong. We're just a different society, but that doesn't mean we can't be equally as compliant. I said this in this press conference today, that I feel like when there's willful violation of our mandate, we should consider stronger penalties. So I'd count me in that camp. I just want to go back also, Dave, to your first question. I don't want anyone to ever look back and say that we didn't say a couple of things. These numbers have gone up dramatically. We expected them to go up dramatically, and we expect them to continue to go up dramatically. This is the fight of our lives. Let there be no doubt about that. Secondly, every state in America, and I've now got ample enough evidence. I spoke to Charlie Baker in Massachusetts yesterday. We were on a video call today. All evidence suggests that every state in America is light PPE. We're hotter than most states, but even on a relative basis, we don't have what we need. And there's an enormous amount. I think we're going to go over this in the next couple of days. We've gotten a lot that's come our way, both from the federal stockpile as well as from other sources. But I would agree with Judy, we're still light. I'm not comfortable with our ventilator levels right now. I feel better than I did yesterday at this time because we got another 300. Our workforce is heroic. I spoke with Debbie White of HPAE. We were back and forth over the weekend. Just extraordinary heroism. Not only do we need the PPE to keep them safe, we need to expand the medical core that we're building is so important because we need the bodies. I'm with Judy. I don't know whether it's by hook or by crook, or thanks to the brilliance of the team up here, it'll be because there was a plan in place, including by our hospital systems. I believe the beds, that we will find a way through the beds. I didn't say this to you earlier. Bob Garrett said they spent the weekend converting the cafeteria at HUMC to some sort of a care wing in their hospital. This is this extraordinary work that's being done. But we are in the fight of our lives, let there be no doubt about it. And the three areas of concern, I'd say as a non-medical professional. One is long-term care facilities. You've already heard us talk a lot about that. Secondly, folks who have adjacent health care challenges, kidney, respiratory, diabetes, etc. And thirdly, certain communities. This is hitting harder in certain communities, whether it's because of their behavior or a community spread or a combination, but those are areas that we are highly focused on. But it is the fight of our lives, and I just would plead again, not just on flattening that curve, but also in the extraordinary work in our healthcare community. We are not an average state. We are an incredibly special state, and now is the time to show that as clearly as we've ever shown it before. Elise, anything?
Regarding the gun sales, will they begin immediately? And in New York City, from the borough presidents, there's a proposal for rental payments to come from security deposits. Is that something you're examining in New Jersey as well?
Sorry, the first question was the gun reality.
Yes.
Is that immediate? Is that effective immediately, Matt?
It'll be effective, I believe, by the end of the day, but I have to look at the order.
And Elise, I apologize, I missed the second.
The borough presidents in New York City are putting forth a proposal for rental payments to come from security deposits. Is that something you're examining in New Jersey?
Not one that I have been a party to a conversation on, but it's not something that I would ignore myself. Dante, move this way if you could, thank you. Matt, that should be on our list of considerations. It's a good idea. So with that, everyone, please, I apologize. We came by real quick. This is going to have to be quick, and I apologize.
Just to follow up, we've heard a lot about the North versus the South in prevalence of COVID cases, but you just referred to communities it's hitting. Can you please elaborate on that? What communities are seeing this more than others?
Well, I think you've got the reality in Bergen County would be an example, which I think is pretty known, right? I don't mean I'm not saying literally community X or community Y, but the notion of community spread is a reality. And we spoke also about Ocean County, where we've got some particular challenges, but it's not one specific community versus another as much as it is regions in the state.
You weren't referring to like communities of economic disparity or something like that?
No. But let me say this. Thank you for asking that question, because that'll give me the opportunity to get on my soapbox to say that the folks who are typically left behind by society will be yet again further left behind as a result of this crisis if we're not careful, if we don't have a proactive set of policies for folks who are homeless or near homeless, or folks who can't make their rental payment. I think you've seen in a lot of the policies that we've put in place, we are doing everything we can to get out ahead of that. Foreclosed homes, preventing evictions from those homes, etc. But I did not mean that. Matt Placken would like to weigh in.
Gun sales will be open as of tomorrow morning at 8 a.m.
Gun sales will be open tomorrow morning at 8 a.m. I noticed the gentleman who normally asks me about this did not come today. He probably feels as though he had achieved some sort of modicum of success here. What's that? He wasn't let in. That was not our intention, by the way. Thank you all. Again, we're in the fight of our lives. We will not win, and we will win, by the way, but we won't win unless we all band together and do our share, each and every one of us. And again, prove ourselves that we're not an average state. We know we're not. We're a superlative state, and that we can come together and both build out the healthcare infrastructure on the one hand, including our workforce, and also flatten that curve by staying home and keeping distance from each other. We're trying to gather more often than not at 1 p.m. We did not do today at 1 p.m. because of the video call with the president and vice president, but we will be back here tomorrow at 1 p.m. Thank you, Commissioner Persichilli, Dr. Tan, Colonel, Director, and to everyone. Thank you.